Hello guys, welcome back to my channel Maniac Medico, and today we are going to continue with the pharmacology. And previously we discussed about cholinergic drugs, so we'll discuss about anticholinergic drugs. We'll discuss with a few examples in the end. Initially we'll study about the action of atropine on various organs of the body, various systems, how it affects it, and then we'll come back to certain drugs which are used in this case. So let's get started. So anticholinergic drug, as the name suggests, it is against acetylcholine. So first drug is atropine. Atropine is an alkaloid derived from the plant Atropa belladonna, also dhatura in simple words. So what are the actions on various other organs? Let's discuss. And also there is another drug, hyoscine, which has the chemical name of scopolamine. So let's start with atropine first. So what happens is, at lower dose there is only peripheral action because it is less effective. It doesn't cross the blood-brain barrier easily. Whereas hyoscine, it is a more potent drug at a lesser dose and it can cross the blood-brain barrier easily. In simple words, this is more lipid soluble compared to atropine. What happens is it stimulates medullary centers. So there is a depression in the vagal, respiratory and the vasomotor. So if there is a depression in the vagal stimulus, as we all know that vagus nerve is responsible for decreasing the heart rate, right? But what happens here is there will be tachycardia. In case of respiration, there will be depression of the respiration, and there will be also depression of the vasomotor centers. Next will be there will be stimulation of the vasomotor centers. Next will be depressed vestibular excitation. So there is no vestibular excitation. It is a very diminished state. It blocks the basal ganglia and it suppresses tremors, especially in case of Parkinson's. So before the discovery of levodopa or L-dopa, atropine was the drug used for anti-Parkinson's, but it had certain side effects which we'll discuss later, and they were the muscarinic side effects. The advantage of L-dopa is it stimulates the synthesis of dopamine in the dopaminergic neurons in the brain, right? Okay, it depends on this type also it is, but mainly it's due to the nigrostriatal pathway where the substantia nigra degenerates, and L-dopa can act only until the neurons are present. Once the neurons degenerate, there is no use of L-dopa, and the drug has to be taken lifetime. With age, the number of neurons diminish and it leads to the death of the person. So at high dose, what happens is causes cortical excitation. So the patient will be more restless, he will have dementia, he'll have hallucinations, disorientation, respiratory depression, and in extreme cases it can also lead to coma. What is coma? It is a stage where the patient is at sleep and his various vital organs are functioning, but he is not conscious. Conscious as in he doesn't respond. We can check it with a thing called as a GCS. It's also called as Glasgow Coma Scaling. We scale it out of 14. And it has various values we'll discuss when we discuss about the CNS in details. Next, let's come to cardiovascular system. As I told you in the beginning, the cardiovascular system, tachycardia takes place due to blockage of M2. So what we studied was M1 is present in the ganglia, right? M2 is present in the heart muscles, and M3 is present in the smooth muscles and certain glands. So here, due to the blockade of M2, tachycardia happens and also decrease in the vagal tone. So the vagus nerve is not that active. Hence, what happens is there is tachycardia. Now let's see what is the effect on blood pressure. As such, there is no effect on blood pressure, but in response to tachycardia, what happens is the blood pressure increases. So here, due to tachycardia, the blood pressure, certainly if the heart is pumping out more blood, the pressure in the artery will be greater due to more load of the heart, right? And at higher dose, what happens is histamine is released. So when atropine is given at a very high dose, histamines are released. And what does histamine cause? It causes the vasodilation, right? Histamines lead to vasodilation. Next, let's come to the eye. What happens in eye when we take atropine? So it affects the autonomic control and causes mydriasis, or also it is called the dilation of pupil. Meiosis is constriction, mydriasis is dilation. Abolition of light reflex. So whenever we put a light on the pupil, what happens is the pupil is supposed to dilate to accommodate more light, and it also contracts when there is high light given, and it dilates when there is low light, by which we can check our vision reflex. But Here what happens is there is abolition of the light reflex, there is no reflex seen. Next what happens is cycloplegia. It is also known as the paralysis of the accommodations of the eye, accommodating muscles of the eye. What happens is it causes the paralysis when consumed for 7 to 10 days. Next what is there is smooth muscles. Smooth muscles get relaxed because of M3. M3 is blocked, it causes smooth muscle relaxation. GIT contraction is incomplete because, as I told you previously also, this comes under the effect of enteric plexus. Enteric plexus is responsible for controlling the most of the motions of the GIT along with vagus stimulation also, but it's more of the enteric plexus. So there is not much contraction of the GI muscles. Then there is relaxation of uterus, detrusor muscles, bladder, and bronchodilation takes place. Next, let's come to gland. So what happens? Sweating decreases, right? So due to sweating decreases, what will happen? The body temperature will rise because the body cannot cool down at all. So if the body cannot cool down, definitely the temperature is going to rise. And also it will affect the hypothalamus, the threshold temperature for fever. It will not lower it. It will keep on increasing it. So what happens is the body temperature keeps on increasing. Salivation will decrease. Lacrimation will decrease. Again due to M3. Acid secretion decreases pepsin and also mucus from the goblet cells. But there is a catch that H2 blockers are more effective in such cases, that is 5-HT, or else in 5-HT, H2 blockers are more effective here. What is H2 blockers is we have two types of serotonin receptors, H1 and H2. So H2 blockade over here aids the decrease in secretions of pepsin and acid. So what happens is in case of peptic ulcers we can use H2 blockers over atropine. Next is the body temperature. As I told you guys, due to decreased sweating, what happens? The body temperature increases and it stimulates the hypothalamus so that the fever threshold is increasing. So the body's temperature constantly rises. As local anesthesia, so atropine has a mild local anesthetic effect on the cornea, that's all, nowhere else. Next is hyoscine. As I told you before, hyoscine can cross the blood-brain barrier, and the best part about hyoscine is it is a potent drug. For the same weight-to-weight ratio, or for a lesser dose, in fact, hyoscine is more better tolerated to the patient because it can cross the blood-brain barrier easily, and it is more lipid soluble, hence it is crossing the blood-brain barrier. And also again, potency is, it is better effective than compared to atropine, and we can use this for the treatment of morning sickness, whereas atropine is used in the treatment of motion sickness. Now let's study about the side effects of atropine. So what happens is there is a term known as atropine fever, which happens more in children, so they are more susceptible to this. So atropine fever takes place in kids, specifically below the age of 4. So they are more susceptible to atropine. It causes dry mouth, xerostomia, dysphagia, unable to swallow, flushing and hot skin of the face and the neck, right? Of the face and the neck. Next, what happens? The bowel sound decreases. Pupil dilation takes place, yes. Photophobia, the patient fears light. Photophobia also happens in the case of meningitis also, but it is also a side effect of atropine poisoning. Hallucinations, yes, again hallucinations, as I told you, in high doses causes cortical excitation, the patient feels hallucination. Ataxia, respiratory depressions, and convulsions. Convulsions, yes. So the diagnosis, what do? We take methacholine 5 mg or we take neostigmine 1 milligram and we inject it subcutaneously. There's an intravenous injection, right? There's intradermal, there is subcutaneous. So we do it subcutaneous, just if we take this just above the dermis, right? It is just above here, subcutaneous. So subcutaneous injection is given. And how do you confirm it that it is atropine poisoning? That there is no muscarinic action seen. Whatever action is done by muscarine, there is no such action seen. Hence, we can confirm that this is the blockade of this is an atropine poisoning, because muscarine is supposed to do opposite of all of these. Like whatever happens over it, it's supposed to do opposite of it. But there is no action over here because atropine blocks the receptor, right? Atropine causes competitive inhibition over here. Atropine blocks the muscarinic receptor because the inducer of muscarine is muscarine itself. But what happens in this case is atropine is blocked it. There's competitive inhibition of the receptor, there is no free binding site for muscarine. So there is no induction of muscarinic action. So how do we treat it? So let me tell you, there is no as such treatment for atropine poisoning, but we can provide gastric lavage with tannic acid or also with activated charcoal. Next, what we can do is we can give cold baths in order to decrease the body temperature, right? Because sweating is not happening over here. You have to keep the patient in a dark room, as I told you, because of photophobia. The patient is photophobic. He has a fear of light. And yes, other symptomatic treatments, like if the patient has a respiratory failure, we have to intubate him or provide him with oxygen at whatever volume needed accordingly. And also we can use diazepam for convulsion. So let me tell you that diazepams can control any type of seizures. It is used as a first aid for seizures, right? First line of drugs. And in emergency, it can control grand mal, petit mal, tonic-clonic, myoclonic, all types of seizures can be controlled by diazepams, followed by their specific drugs or add-on therapies. We can't use benzodiazepams for a longer time. There are many side effects of it and various other things we will discuss in the coming chapters. But as of now, by diazepams, please remember that we can use it for emergency control of convulsions, right? So let's talk about interactions. How does atropine interact with other drugs? So what it does is drug absorption of certain drugs are decreased, right, due to delayed gastric emptying. As I told you, the bowel sound decreases, so there is less bowel movement, hence there is less bowel sound. So what happens is drugs such as L-DOPA, which are not supposed to be remaining in the GI tract for a longer time, their absorption decreases, so hence this drug is ineffective, right? Drugs such as digoxin or tetracycline absorption C. So drugs like digoxin and tetracycline, they require a longer time to spend in the GI tract, hence their absorption is aided, right? Antihistamine and antidepressants, so they too have an anticholinergic property, and they can also produce certain side effects, right? And also MAO, monoamino oxidase inhibitors, interfere with metabolism of levodopa or other such drugs, right? So glycosaminoglycans antibiotics can be one of the examples of MAO inhibitors. So if a patient is consuming MAO inhibitors, then we cannot use such drugs like antihistaminic drugs or cardiac glycosidase or antibiotics, right? Because atropine, they are also they have anticholinergic property, and even atropine has an anticholinergic property. So you can understand how difficult the situation gets for the patient, right? So for the treatment, what are we doing? We're providing the patient with gastric lavage, and yes, the important part over here is KMNO4. Potassium permanganate cannot be used over here for oxidation of atropine, right? KMNO4 cannot be used over here. It is ineffective. We can use activated charcoal, we can use tannic acid, but not KMNO4, right? So now we will be discussing in the further part about certain drugs, certain important drugs, and about some drugs with various pathways like succinylcholine. They work in two phases, phase 1 and phase 2 interactions. And with that, that will be the wrap of this chapter. We will discuss about few important drugs which are used in our day-to-day life. So guys, let's continue with the drugs. So let's start with hyoscine butyl bromide, or else another name for it is scopolamine. It is used for esophageal and GI spasm, right? Next, let's come to atropine. Atropine can be used for many things, like for curing of Parkinson's to some extent, or in some cases of glaucoma, and for abdominal colics or hyperactivity of the abdomen. To some extent, yes, there are specific drugs which are better, like I told you, H2 blockers, histaminic blockers, they are better, but atropine can be used in such cases. Next, let's come to ipratropium and tiotropium bromide. So these drugs are used in COPD. So what is COPD? Chronic obstructive pulmonary disorder. There are two types. There is obstructive and destructive. One of them is where the patient is not able to breathe in. The other one is where the patient is not able to breathe out. So this is what happens in COPD, followed by various types of diseases. We will discuss it when we discuss about the respiratory system. Out of these two drugs, tiotropium bromide is a better drug because they firmly bind and form a strong bond with M1 and M3 receptors directly. Next is for peptic ulcers. As I told you, atropine can be used, but oxyphenonium or propenthyline, right? They are better drug of choice. But yeah, the best one again remains H2 blockers. And yes, glycopyrrolates, these are the drugs when inhaled, right? When inhaled, they can provide only symptomatic relief in COPD but not the cure, right? Only symptomatic relief in COPD. Next is for inflammatory bowel syndrome. What happens is we can use slimentropium or isopramidine. These drugs are used for inflammatory bowel syndrome. Next is sulfasalazine, which is used in renal colics, also you call as the kidney stones in normal words. Next is tertiary amine compounds. So there is velethimate and diclonamine. So this is M1 selective drug and it is used in antispasmodic. You might have also heard about meftal. That is also an antispasmodic drug. Most of the girls might know it. Similar to this is an antispasmodic drug, and also this drug can cure morning as well as motion sickness. This drug cures morning as well as motion sickness. Next is velethimate, which relaxes the cervix. So this is an antitocolytic drug. So antitocolytic drugs are the drugs which delay labor. So if the cervix, what happens in the labor is the uterus contracts, the cervix contracts, the myometrium is contracting continuously under the action of oxytocin and fetal ejection reflex. So in order to delay labor, what we do is we can give velethimate, which is an antitocolytic drug. We will study one such example in even adrenergic drugs, right? Next is bladder selective. Oxybutynin, it is used post prostatectomy. So when there is benign hypertrophy of prostate, so it has to be removed surgically. So after the operation, what happens is there is chances that there is urine retention taking place. So this is the bladder selective drugs which causes contraction in the bladder and hence the urine is pushed out. Next is for mydretics, nothing but the opposite of meiosis. So we can use tropicamide and cyclopentanol. So these drugs are used topically, that is directly applied to the eye, right? We cannot use them for a longer time. It has to be set for a few days. Next is anti-Parkinson's drugs. So cyclodol is a good example of anti-Parkinson drugs. So what is Parkinson's, right? So it is simply the degeneration of the substantia nigra in the brain, which is responsible for the production of dopamine. It consists of dopaminergic neurons. But what happens is dopamine is decreased. So you will be wondering why anticholinergic drug is given. So we can either elevate the level of dopamine or we can control the level of acetylcholine. So both ways we can control Parkinson's. So atropine was used, but these drugs are also useful in controlling Parkinson's, right? For the patient will have tremors, he will not be stable, right? These are the symptoms which happens in Parkinson's. It is a degeneration of substantia nigra in simple words. Next is Sugamadex. It is a gamma cyclodextrin. It binds to steroid drug. It binds to the steroids, right? All the steroidal, like glucocorticoids, mineralocorticoids, testosterone, estrogen, they are all steroids in our body. It binds to the steroids, and this drug causes spasm, right? Next, our drug is suxamethonium. This was Sugamadex. This is suxamethonium. So what happens is this causes muscle relaxation, right? So there are two phases. In first phase, what happens is the depolarization is blocked, right? Once the depolarization is blocked, there is no stimulation possible. The furthermore stimulation cannot pass on, and hence the muscle stays in a relaxed state. Acetylcholine esterase enzyme doesn't play any role in this. If we have to reverse this, we cannot use acetylcholine esterase over here, right? Because there is already shortage of acetylcholine, and if you use the acetylcholine esterase, there is no use over here. Next is the phase 2. There is a decrease in depolarization and desensitization takes place. That is, the neuron cannot depolarize anymore, right? And it can be terminated by acetylcholine in such a case. This is mainly used during surgeries to relax the patient, but it has a side effect. It can cause bradycardia, hyperkalemia, that is elevated potassium in the blood, and also paralysis, because the muscle either stays in the state of contraction or relaxation for a longer time, and hence it can cause even paralysis, right? It can be reversed by tibocurin. As we told you that myasthenic patients are highly sensitive to tibocurin, so even tibocurin can cause muscle relaxation over here. Next is physostigma. I forgot to mention, sorry guys. For treatment of atropine, we can give 1 to 3 milligrams of IV injection of physostigmine for atropine poisoning. Next is ganglia blockers. So what are ganglia blockers? So there are two drugs. These two drugs are used for controlled hypotension. Hypo, that is low blood pressure. So during surgeries again, suxamethonium and ganglia blockers like trimethoprim and hexamethonium are used. So this relaxes the patient and this decreases the blood pressure. This is controlled hypertension because we can control it. We want to terminate it, we can terminate it, right? But it is contraindicated in patients who consume MAO inhibitors or even drugs which inhibit CYP3A, right? Because they furthermore decrease the acetylcholine, they prevent the transmission, and hence they are contraindicated in such cases. Next is bupropion and mecylamine, right? Mecanamine. So bupropion and mecanamine. So these are the drugs. So bupropion specifically, what it does is it prevents the reuptake of dopamine and noradrenaline. So there is a reuptake in the exoplasm. What happens is there is VMAT, vesicular monoaminotransferase, which is responsible for the taking up of noradrenaline, and also dopamine, basically catecholamine. So what happens? It inhibits the reuptake of dopamine and noradrenaline. So what happens is the person who is abusing the tobacco or cigarette, he doesn't feel a sensation of pleasure, right? Hence, when there is no sensation of pleasure, so they will think just to quit the smoking or chewing of tobacco, because the only perspective of consuming tobacco or smoking was for the pleasure, but this drug prevents it. And the second drug, it can be used with nicotine and it can be applied as a transdermal patch. We take a certain area of the body which is highly vascular, we apply it as a patch over it so that the nicotine just enters the blood and the harmful chemicals like carbon monoxide and other carcinogens don't enter the patient's body, and hence he gets the pleasure of nicotine without having to inhale so much of carbon monoxide and various other forms of carcinogens. So these are used as treatment of smoking and tobacco abuse. With this, we have concluded anticholinergic. What was the main drugs? What are the drugs used in various things? Now it's a wrap. And if you like the video, do like, share, and subscribe to my channel. And you can ask your doubts in the comment section. You can ask for the notes also in the comment section. I do reply to every comment. And for now, it's a wrap, and we will meet you next time with the chapter adrenergic drugs, right? It's an interesting chapter. We will continue that. Thank you.